In part two of this week's lecture from Chapter 4 on child physical abuse, we'll be talking about some of the characteristics of both physical abuse victims as well as the physical abusers themselves, some of the explanations that the experts have for the causes of physical abuse and child physical abuse and why it occurs, and also some comments and thoughts about our response to it as professionals and as a system and a community. First, a little bit more actually about the characteristics of physically abused children. A study in 2008 from the National Child Abuse Neglect Study indicates that 13.2% of physically abused children were less than 1 week old. Now, stop and consider that. That means that 13.2% of physically abused children in our national statistics are neonates. They're newborns, and I wonder because these statistics are just kind of presented in the textbook, and would no doubt bring up all sorts of images of newborns being shaken and battered and slammed against the wall and those kinds of things. And I wonder if this figure has to do with how, again, these statistics are being gathered and what we're defining as physical abuse. For instance, we often get reports in our office about children who are born dependent upon drugs because the parents were using substances during their pregnancy, and children newborns going through withdrawals after birth because the parent was using different kinds of drugs while the child was in utero. And so in some states that might be classified as neglect. In other states that might be classified as physical abuse, and I'm just wondering if perhaps the high percentage here relates to the fact that we're talking about kids that have been the victims of parental substance abuse during pregnancy. Now, that's not to say that it shouldn't be characterized that way, but again, the image of physical abuse tends to be one where you have this picture of somebody striking the child, and I don't believe that 13.2% that 13.2% involves the traditional kind of physical abuse like we tend to think of. Most studies suggest that the frequency of physical abuse seems to peak between elementary and junior high school years, and so it is those age from school age up to middle school at least where the most of the physical abuse seems to occur. That makes sense to a certain extent because the children, when they get into high school, they're bigger. And oftentimes, as you'll see later on when we look at adolescents, a lot of times the system tends to want to set them aside and not really deal with the physical abuse of those kids, seeing sometimes that them almost as the provocateurs of the physical abuse kind of, and so it doesn't surprise me that the statistics fall off for younger high school kids, or older high school kids, I should say. Also, though, children in school are observed by teachers and other community members on a daily basis, and so there are going to be more reports on them than kids that are in preschool. So what does this tell us? This doesn't mean that children that are of school age and into middle school get abused more. What it does tell us is we get more reports of those kids, and those are some of the reasons why I think that might be the case. Boys tend to be at slightly greater risk for child physical abuse than do girls. Child physical abuse tends to occur more often among those lower socioeconomic status families, socially disadvantaged families. Doesn't mean that it doesn't occur in individuals from middle class and even upper class families, but that again, statistically speaking, it tends to occur more often among those families from the lower socioeconomic groups. And partly when you consider the stress that's involved in poverty and unemployment and having trouble paying bills and all of those things, it's not too surprising that there might be a higher level of abuse at that level, at that socioeconomic level. There are studies that say that African American children may be at greater risk for physical abuse. If you look at the statistics in the book, it appears as though that proportionally speaking, they're more frequently the victims of abuse. And children with disabilities, and this is not only physical disabilities but also emotional disturbances and learning disabilities, tend to experience physical abuse almost twice as frequently as those without. And there's a side note from the text that says that the child protection workers tend to treat abuse of disabled children differently tend to be less likely to initiate investigations in those cases and attribute the abuse of disabled children to the stress related to raising the child. In other words, the parents oftentimes aren't held accountable for that because of the particularly difficult situation that they find themselves in raising their children. We have a dangling sentence there. We're more likely to recom, and I don't know, recommend, and I'm not sure where that went from there, but I lost it with that slide. Adults who physically abuse children, some of the characteristics of those individuals, and we're talking in generalities here, of course, but younger parents are more likely than older parents to physically mistreat their children. More males physically abuse children than do females. African American and Latino parents are proportionally overrepresented among abusers. Asian parents are less proportionally represented. They're underrepresented among the abusers. In other words, they tend not to be in the statistics as being abusive. Birth parents are the perpetrators in the majority of physical abuse cases. But again, this could have something to do with about how data is collected and gathered and those kinds of things. Single parents, overrepresented among abusers. Those single parents living with, and well, they're not single anymore, but those parents living with cohabitating partners have the highest rates. So those individuals who are living in a non-marital relationship tend to have the highest rate of physical abuse. And interestingly, children who are cared by grandparents are less apt to be abused than those who are cared for by their parents. When we look at adults who physically abuse children, there are certain sorts of qualities and characteristics surface, and they're worth talking about here. First of all, they tend to have emotional and behavioral difficulties of their own, depressed, deficits in empathy, and this is an area that is worth attention. Empathy, of course, is that capacity to be able to put yourself in another person's place and to understand what they're going through. And child abusers, physical abusers, are low in empathy. Probably not very surprising when you consider this. This is also going to be true, you'll see, when we talk about sexual abuse perpetrators. This is one of the hallmarks of sexual molesters, is the lack of empathy for their victims. Rigidity, low self-esteem tend to be substance abusers. You can see the different qualities here for adults who physically abuse children. And some important things to consider. First of all, that substance abuse problems are significantly related to the recurrence of child physical abuse reports. So that in those situations, those families where we have substance abusing parents and we substantiate, or we get reports of concern about child physical abuse, those reports tend to repeat themselves with parents who are substance abusers. And there is some evidence to suggest that abusive parents tend to automatically interpret ambiguous child behavior in negative ways. This is one of the things that may prompt those individuals to become abusive, is because of the way they interpret what they see. They personalize acting out behaviors or disturbing behaviors or unacceptable behaviors on the children's part, or take it as a personal reflection of themselves and their own parenting, those kinds of things. There is also a lot of interpersonal difficulties, both in the family and without the family, but in particular some tension with the spouse or their partner. That goes from simple disagreements to the physical abuse between the partners. History of abuse in childhood, very few positive social interactions, and social isolations. This is something that's not surprising, but it says here that abusive parents tend to report more conflict in their families of origin. And they have fewer interactions with their own children, and they are more likely to physically abuse their marital partners. So you see here there's a fair amount of crossover with abuse, both from the past to the present, as well as in the different kinds of relationships, so that not only are they physically abusing their children, but they're more likely to be physically abusive of their adult partners as well. Adults who physically abuse children experience parenting difficulties, not a surprising thing, but A lot of times these difficulties arise from their disregard for children's needs and their poor capacity to manage children's behaviors. Oftentimes we refer parents that we encounter in our work to parenting education, and I often say that I believe that we do that prematurely and too frequently, because parenting education for a substance abusing individual, or someone who lacks the capacity to connect on a basic human level with another human being in a trusting relationship, parenting classes is like graduate school for some of our families. And so while parenting education, while they lack child management skills, that may not be the first thing you want to refer your families for or to when you work with them. Again, you see negative views of children, unrealistic expectations. Oftentimes, abusive parents don't really understand child development, expect that kids should be able to do things that they can't do. Again, a lot of frustrations, for instance, around potty training and this overinterpretation of what it means when potty training isn't successful. It creates more stress, and of course that's going to make potty training more difficult for the child, and yet somehow this all comes through with a personification of the child's behavior, as though somehow it's directed at the parent, and expectations that the child somehow be able to manage things that just isn't, or they aren't physically or developmentally capable of managing. Biological factors included a lot of physical health problems and disabilities, and sometimes abusive parents tend to be overreactive physiologically. We do have, when you think about this, if indeed they were themselves victims of physical abuse, and that's not always the case, but often is. Remember, we were talking about how physical abuse victims of abuse learn to kind of live in that fight or flight kind of center of the brain. Then it's not too surprising that when an event occurs, their response to that physiologically may be much more severe than the average person's response to those things. And so they may be physically overreactive to things, which could explain, again, some tendency to lash out against the children. So findings have consistently demonstrated that physically abusive parents are hyper-responsive to child-related stimuli such as crying. And so just some things to think about there. Mental illness really isn't viewed as an explanation for child abuse in most cases. Only about 10% of the abusers have severe psychiatric diagnoses, and so oftentimes you'll refer abusive parents for counseling and therapy, and there are those that do have mental illnesses. But we think about the traditional mental illnesses, those schizophrenia and bipolar disorder and those kinds of things that we tend to think of. There's not a lot of parents that really suffer from those disorders in this group. We do see a tendency, though. Depression is very, very common among abusive parents, and in particular with mothers with postpartum depression and kind of related psychoses. It says here that somewhere from 11 to 16% of mothers in the United States experience depression in the first year after childbirth. And while few mothers actually harm their children as a result of that, many are disturbed by recurrent thoughts of doing so. This is a postpartum depression, and is still something that really is being studied and isn't, I think, fully understood. But it is generally considered to be a brain-based disorder. There are recent research to suggest that hormonal-related issues could be the cause of postpartum depression. Still, the public, when mothers become abusive during postpartum periods because of this depression, the public tends to view this as criminal activity and wants to see those mothers punished, and not really recognizing the things that are going on with that mother, that may explain it, that are biologically based. I think this is where the textbook talks about Andrea Yates, the mother in Texas who I believe drowned her children, 4 of her children, that's a very interesting case, and it's one worth worth researching if you're interested in this particular topic, because there's indications that postpartum depression had a great deal to do with that event. And so it's a very interesting case that ties into this anyway. And so there's recommendations that we be very careful about screening for depression during pregnancy and in the postpartum depression. We tend not to identify postpartum depression as often as it exists, and so likelihood is that that problem is undertreated. Some other explanations for physical abuse, what causes child physical abuse to occur. If we move away from the concept, at least, of the mentally ill parent or the depressed mother or the depressed parent, another model is the difficult child model. We in the olden days we used to call this victim-provoked abuse, and this was the suggestion that the physical abuse is caused by the behaviors or temperament of the child. And it is, I think, commonplace that children with psychiatric diagnoses are at greater risk for abuse and for poly-victimization as well. But an important factor if you go to work in this field is to keep in mind that the behavior of the child should never be accepted as the justification for violent behavior by an adult. It may be a provocation. There may be some things in the child's behavior that set the stage for that response by the adult, but the adult has to be held responsible for their behavior regardless. So, and there is sometimes a tendency among CPS workers, particularly with difficult children, to again back away from holding a parent accountable for their response to those behaviors when it becomes abusive. But children should not be held responsible for their victimization. The parent-child interaction model kind of takes this a little bit further and looks at the interaction between the child's behaviors and the parent's behaviors. So children who are physically punished, for instance, tend to experience less maternal warmth and less paternal warmth as well. And so they have less protective parental bonding and have a great likelihood of psychiatric disorders. So you can kind of see there where the physical abuse, in some respects, the physical punishment promotes this disengagement with the parents and not really being connected with the parents. And it's not too difficult to imagine that this might lead to some psychiatric issues and things like that for the child. And so there's sort of a vicious cycle there. It isn't the child's behavior, it's the interaction between the two, between the parents and the child, essentially that explains it according to this theory. So there may be early attachment difficulties connected to this, but it's likely to lead to more difficult behaviors that challenges the parent's capacity to cope. And so there are a number of different places you can intervene in that cycle there to help change that. Munchausen's by proxy. This is sort of like I used to say in child protection that this is sort of like the multiple personality of child protection. Among mental health circles, I think it's mental health therapists. Everybody wants to have a multiple personality in their caseload. Somebody that's genuinely an MPD, and well, that's sort of I think kind of a little joke about the field, but nonetheless, among social workers, I think Munchausen's is one of those things that you see a lot of times. People say, I think this is a Munchausen's case, when it really isn't. But those cases where Munchausen's by proxy really does exist is a situation where adult caretakers falsify physical or psychological symptoms of their children to medical personnel to meet their own pressing psychological needs. Baron von Munchausen was apparently well known for feigning all sorts of physical disorders and things like this. So he had a lot of doctor's attention and things like this. So that's where the Munchausen's by proxy comes in. The parent here, usually the mother, as the primary caretaker, has some psychological needs that are fulfilled by by having a lot of doctors pay attention to her child. And so sometimes these parents falsify physical or psychological symptoms to get medical attention. And the interesting thing about these cases are usually when the doctor makes a diagnosis, not knowing that the parent may be falsifying or creating the physical condition that is causing the medical treatment, and the doctor makes a diagnosis, oftentimes the parents will object to that or will insist it's wrong and go seek a second opinion. And so while they seek out doctors, they also denigrate the diagnoses those doctors make and continually go to other physicians and insist they know better and that they're not getting the proper diagnosis. And they become very difficult cases. So this, of course, as you can see, would be abusive because of the physical and psychological harm that would come to the child for this kind of thing. Social learning theory suggests that most or many of the adults who abuse children were abused as children themselves. When I first prepared this slide, I had typed in that, let me see, what was it, that a significant percentage of abused children go on to abuse as adults or something like that, but it really is backwards. And it's important to understand that what we're saying here is that a large number of adults who are abusive of their children were abused as children themselves. Not too surprising, really. It isn't necessarily the opposite truth, that if you are abused as a child, you are more likely to become abusive as an adult. There's a difference there, and it's important to keep in mind. But this does suggest that for many people, at least, this abusive behavior was learned through the example of their own parents, and they didn't really have an opportunity to learn other ways to parent their children because of that. So there's an intergenerational transmission of attachment styles and so on. Some experts believe that there are situational and societal conditions that explain physical abuse, so that those families, for instance, in lower socioeconomic groups that have low income, families with unemployed or underemployed fathers, socially isolated families that don't have the kind of support from extended families necessary, these things create stresses in the household, which can also set up the situation for physical abuse to occur. In and of itself, they don't explain physical abuse because there are many poor families, many isolated families, many parents who are unemployed who never raise a hand to their children. But these conditions can be viewed as contributing to the problem. And stress in general, as you see here, higher levels of stressful events in life and in parenting tend to be associated with increased rates of physical abuse. For instance, they talk about military families and that the child abuse rates tend to increase around times of deployment and return from deployment. And children with deployed parents tend to externalize their behaviors more, and so the parent left behind tends to have more depression as well. So anyway, another explanation. Then the belief that, well, culturally we accept corporal punishment. We know that. Children and wives are seen as property of parents, and we'll be talking more about that as the semester goes along. But abuse becomes permitted because the fathers or the parents of the children have the right to expect certain things and have a societal responsibility to shape those behaviors. Physically disciplining wives is no longer illegal in the United States, and it wasn't so long ago that it was. But physical discipline of children remains legal. And of course, when physical discipline gets out of control, injuries and fatalities can occur. There's also some mention about how some evangelical religions tend to interpret the Bible as endorsing the use of physical discipline. The spare the rod, spoil the child statement from the Bible. Again, this is going back to the idea of the discipline and what is discipline. Disciple being the root word, and you lead by example. The shepherd, the example I think is the shepherd's staff is the symbol of the leader or whatever, and the shepherd doesn't beat his sheep with the rod, which is the rod in this statement, I believe. The shepherd leads with the rod. The sheep see the rod and follow the rod, and so In the event, this is one of those things that frequently you'll find frequently quoted to you, and as you visit families that have been overuse of physical discipline. Let's say, spare the rod, spoil the child. These beliefs do not incorporate acceptance of child physical abuse. There are another theory about risk factors for physical child abuse. The cultural acceptance of corporal punishment creates an environment that is conducive to physical abuse, and kids who are frequently spanked is a good predictor of physical abuse as well. And also using objects on the buttocks is a strong predictor of physical abuse. And here again you see polyvictimization and overlapping risk factors that in one Canadian study the effects on health from physical or sexual abuse were higher than other types of abuse. And the conclusion was that with each additional abuse experience, negative health effects increase in later life. And that really ties back to the adverse childhood experiences, the ACE study that we had talked about a few weeks ago. So there are factors in families that might serve to reduce the likelihood of abuse, and here are some of those factors. There's certainly not all of them, but a supportive family environment, and with a supportive family environment, we're not only talking within the household, but we're also talking an extended family system: aunts, uncles, cousins, grandparents, older siblings, whatever it might be, people that are out there in the community who we can turn to in times when we're under stress and as parents, or that children can go to at times when they're troubled, and those things really help to guard against abuse occurring. And so when you're working with physically abusive families, one of the things that you want to try to do is to connect them with social supports, people that they can turn to on a daily basis, if not family, perhaps close friends. Nurturing parenting skills, that somebody really knows how to raise kids without using discipline, physical discipline. That there's a household with some structure and rules that tends to create and shape more positive behavior from children, clearly. Communities that are protective of families, that have programs in place for families that help, and recreational opportunities. Families that provide age-appropriate supervision of their children, parents who are working, adequate housing. You see the kinds of things here that kind of work against situations where children are physically abused. And these are the things, if you have things you have to take out of families when physical abuse occurs, these are the kinds of things you want to put into those families. You can't just take things away to fix the problem. You also have to put things in. And so these are some of the things you want to plug parents into. There are transactional theories that focus on the importance of the factors, the characteristics of the individual, the family, the community, the culture to explain child maltreatment. So what these transactional theories really say is it isn't any one of those things we just went through, but it's really an interaction of all of those things. And this emphasizes the interactions of risk and protective factors associated with child abuse. There are things that suggest that child abuse is more likely to occur. There may also be things in the environment that can serve as protective factors to prevent that abuse from occurring. And it's important to recognize and identify both. A few slides finally on practice, policy, and prevention. As practice has moved away from the mental illness model of explaining child physical abuse, interventions have broadened to include both adult and child-focused interventions and community-level interventions that are intended to reduce the isolation and stress of families. There are 4 things that the textbook says physically abusive adults should have, and again, I would suggest to you that this might be backwards. This list might be upside down. And by that I mean parenting skill training may not be the first thing you want to give to abusive parents, but correcting their cognitive distortions, their improper attributions, this overinterpretation of children's behaviors that we were talking about earlier, helping them to develop emotional coping skills and to develop their own ability to regulate their own reactions and emotions and things may need to come before you can really start giving them concrete skills, not only to correct bad behaviors among children and troubling behaviors, but also to encourage good behaviors and how to provide nurturing interactions with your children. These are things that come later, I think, but they're important to be provided for physically abusive parents. And you can see different kinds of interventions and treatments that are used here. In-home treatments are something that has become more and more commonplace in communities that address physically abusive families, so that sort of a mentor is put into the home, a teacher, so to speak, that works with parents in the home setting with their children and encourages the proper interactions and helps the parents develop skills and abilities to interact positively with kids and respond consistently and effectively to troubling behaviors and things like this. There are problems in the development and implementation of state statutes about child abuse. For instance, the confusion about the definition of abuse and the balance of children's rights versus parents' rights. In the state of Alaska in particular, there's a strong push for privacy rights of individuals, and so you really have to have a reason to be on somebody's doorstep knocking on their door asking to talk about how they raise their kids. But at the same time, parents' rights, this tendency to believe that we own our children, that needs to be challenged too, because the children do have rights as well. How do you address complex human behaviors in legal statutes? And you can again see some of the many difficulties that there are in terms of the various definitions of abuse and how people are dealing with mandatory reporting requirements. Prosecution is another issue where, the funnel of prosecution, where you start out with this large number of offenses, and by the time you get to those that are actually, being prosecuted for the crime, whatever that crime might be, it's a very small percentage at the tip of the funnel. And this says about 10% of child maltreatment cases proceed to trial. And I'd say that's high in my own experience. Physical abuse cases rarely go to court on criminal charges, at least in our state. It has to be a pretty serious assault for that to occur. Hitting children is a clear violation of human rights, of the children's human rights, according to the text. And the United Nations, the text points out in closing this talk, I want to talk about the United Nations statement that says that no violence against children is justifiable. And as the textbook points out, as of 2010, 24 nations in the world have banished corporal punishment of children altogether. You do not punish children physically in those countries. It's against the law. And all nation members of the United Nations have ratified the Human Rights Conventions for the Protection of the Child, except for two, Somalia and the United States. That is something that is worth considering, and again, probably connects a lot to our love of violence in this culture and our desire to protect our privacy in raising our children and dealing with our families. So this is something that's worthy of a great deal of reflection as we continue working through these topics this semester. So that will be it for this week. I hope that the information that you gathered through these two parts of this week's lecture was of use to you. Should you have any questions, please contact me and I'll do my best to try to help you with it. Thanks very much.